Hello everybody, thanks for tuning in. My name is Jamie and I'm about to get cosmetic surgery done tomorrow, specific to tummy tuck, liposuck, and gynecomastia. I wanted to make this video for the men, for the boys, as there's tons of media out there of women having tummy tucks done and talking about their experiences, which is, somewhat informative, but one thing, after scouring the internet, what I found it was lacking was male perspective and male thought, male pride, male thoughts, etc. And so if I had that available to me, through this process, while doing my due diligence, I probably would have got to a more comfortable place faster. So I'm hoping by, doing what I'm doing here and explaining my story and thoughts, feelings, process, progress, etc. Will help you guys out, and maybe we can, make a few people feel better down the road. My story over the last year or so, really got my shit together. Hit 300 pounds about 12 months ago, 13 months ago. That's a number I never wanted to see, and sure enough I saw it, and that really hit me like a ton of bricks. For whatever reason, extremely unhealthy. Couldn't walk long distances without having ankles swollen. Varicose veins in my legs, getting short of breath for ridiculous, small exertions that I would do, and get short of breath and winded from it. Drinking like a fish, popping pills, prescription pills for anxiety like crazy, benzodiazepines, which really fucked me up. Ultimately, antidepressants for the anxiety, just various unhealthy, lifestyle that I was living. I'm not sure if you guys ever saw the Australian documentary Fat, Sick and Nearly Dead, but if you did, or if you're gonna Google it, that was me for sure. Definitely a movie that inspired me when I was right around that 300-pound range to get my shit together. And today, a year later, 13 months later, I'm down 60 pounds. I'm on absolutely no medication, no prescription medication at all. Haven't had a drop of alcohol in 13 months. No other recreational drugs, no cigarettes, just no bullshit. And I'm a much better person today because of that, and a much healthier person, much happier person, just more content, etc. Turning my life around here. The next step in my journey of getting my shit together and moving forward with finding inner peace and happiness is this surgery, and having this work done, because it is a mental fuck, if you will, to my confidence, to my spirit, to my person, and comfortability with myself, and the amount of time I put in my day thinking about how bad I look, or waking up in the middle of the night, or even first thing in the morning and walking into the bathroom, jumping in the shower and looking in the mirror and seeing myself naked, and just being turned off and unhappy. And it just basically I start my day with depression and with feeling down on myself, and in my line of work, that's really not an option. I gotta hustle and have a strong poker face at all times, and I do that well, but just I need my confidence, and I need to feel normal. I don't want to feel deformed, because that's how I feel. I feel deformed. And when your body and your skin, when you lose 60 pounds, when you're 300 pounds and you go up and down 270 to 300, back and forth, your skin stretching in and out, elasticity just becomes next to nothing. You just lose muscle, etc. in your core. The rendering of a 60-pound weight loss and a very unhealthy lifestyle for many years, it's not pretty. And you know, that's pretty much why I'm doing this and why it's a must, because I figure if I get this done, you know, I have some contour, I look human, I don't look all saggy and pockety, and you know, a plump chest, as we all know, that's not very masculine, and sure doesn't give you a good feeling of masculinity. And having to wear tight undershirts so they can press you in and then put your shirts over it, so you know the bulge isn't so apparent, or at least apparent as you think it is as you're walking down the street and people looking at you. Just a mess. So, you know, long story short, getting the surgery done. It's a process just to get to the point of execution. Surgery is tomorrow morning, 6:15 a.m. I mean, you know, it's bad enough getting surgery, but you know, having to be at the hospital facility at 6:15 a.m. is a whole other story. Couldn't get an appointment later in the day. I'm anxious. I'm nervous. I'm always anxious of the unknowns, and at the same time I'm excited, because I really think that I've finally come to terms with that this is what needs to be done to get yourself to the next level, to get your inner peace to the next level, to enhance your workout results. You know, working out, I could run, you know, many miles every day, 7 days a week, and you know, I'll never firm up the way I think normal people, normal in shape skinny people look, and that's what I want. That's my goal. I don't need to be Rambo or six-pack abs, but I just want to be non-deformed, and you know, that's what I'm looking at. So surgery's coming. Got a great facility, I believe is a good facility, that I'm going to. Done a lot of due diligence, been to a lot of different appointments, a lot of different consultations, trying to find my budget, trying to find a certain level of comfort with the doctor, and just needing to get my head around the fact that I'm actually going to pay somebody to cut me open from side to side, scar me for life, just to enhance my physical appearance. And you know, a lot of people will say, you know, oh, you look great, Jamie, you don't need to do something like that, you're fine, it's all good, you know, why are you even thinking that? You know, and I appreciate those people, thank you for that, but I'm just, you know, I'm scarred, you know, I'm scarred from the weight loss, renderings, residuals, you know, and I just need to get to a certain point to be happy, and I keep harping on that. And guys, if you're not happy and you're hearing some part of you in what I'm saying, you know, I think it's normal. I think what we're feeling here is normal, and it's obtainable to get the happiness that we want to. You know, it took me a long time to get here. That I'm ready to go, but it's go time, and it's moving on. So Phil, the doctor, did a pre-op appointment 2 days ago, and that was good. Made final payment. Got a bunch of prescription pills that I needed to start taking. Needed to have with me. I have antibiotics that I needed to start 1 day prior to the surgery. Oxycodone for potential pain. They ask you to take the oxycodone preemptively. Of course, during the surgery, you're gonna have tons of anesthesia, and they're also gonna have a lot of local anesthesia throughout the stomach area, from which I've talked to references of this doctor that they gave me as I was doing my due diligence to check him out, and you know, they told me that he applies a significant amount of local anesthesia, so some of them didn't even feel pain. You know, they didn't. The worst feeling that I heard described from the pain of a full bore tummy tuck was the fact that this tummy tuck basically felt like you went to the gym, you had a kick-ass workout, ab-wise, you did like 1,000 crunches, and the feeling of that tight soreness that you get from doing a bunch of crunches or sit-ups, etc. That was what they compared it to, and I'm hoping that's true, because that's a feeling I can deal with. But the oxycodone they ask you to take every 4 hours or as, no, what does it say here? Every 4 hours as needed. But they ask you to take it preemptively. Don't wait for the pain. Take it beforehand. That makes sense, because why feel pain if you don't have to? Blood thinners, big problem with surgeries like this. I don't know if it's a big problem, but it's one that needs to be addressed and paid special attention to, is developing blood clots, in your legs. So they need you to take these blood thinners to thin out your blood and lessen the chances of developing a blood clot. And that's very important. Also ambulatory, getting up, walking around, pumping your legs while you're in bed to just keep shit flowing. And they gave me some shot stuff. I mean, it looks like injections that I gotta give myself. Not exactly sure what that is. I'll update you later. Enoxaparin sodium injection. So I forget what that was for, but they gave me all my goodies, so I'm ready to go with that. Got to bring all this stuff out there with me. They also told me to start pumping vitamin C, 1,000 milligrams a day for 2 weeks prior to the surgery, which I've been doing, and to pump iron, lots of iron, 65 milligrams once a day, 2 weeks prior to surgery. So I've been doing that. So these are my to-go goodies, which should have me set up nice, help minimize the unpleasant things that come along with such a invasive, aggressive surgery. They also gave me some pre-op instructions. I'll tell you a few. It's mandatory, but number one, they put out there in big letters, plenty of exclamation marks: don't smoke, no smoking. Stop taking all vitamins. Start taking the vitamin C and the iron. Big one: do not take aspirin. Do not. Everybody I've talked to while doing this due diligence up to this point, absolutely no aspirin. Worst thing you can do. If you absolutely need something for pain or headache management, Tylenol was the option that you can work. Only Tylenol-based products. Start the antibiotics the day before, which I've done. Keflex. Purchase a stool softener. Apparently in surgery your shit gets clogged, and I want you to have a stool softener on standby in case you absolutely need it to get things moving. And what else? Shower the morning before the surgery with antibacterial soap, dial soap. Very important. Don't eat or drink anything after midnight the night before your procedure. No water, no food, no gum, no mints, no nothing. Leave all your valuables at home. That's a bit odd. Figure people stealing from you while you're under in surgery. That's a bit weird. Don't wear nail polish on the fingernails. I think, guys, we're okay with that, most of us. Do not wear contact lenses. Be sure to arrange appropriate transportation. Wear loose and comfortable clothing. That's a no-brainer, really. Big fat sweatpants so you're comfy. Fill all prescriptions, obviously, and so on. So those are some of the pre-op instructions that they give you, and pretty basic, nothing too in-depth. What else they give me? Yeah, more literature on proper ambulation, so you're not developing DVTs, deep vein thrombosis, PE, pulmonary embolism, and the like. Walk, pumping your ankles like you're driving while you're laying in bed. Hydration, they're recommending drinking 9 to 14 8-ounce glasses of water per day. Some of the things, so that's all. This is serious shit. You don't want to develop that. And I guess they have like these boots they put on your legs while you're laying in bed that, I don't know, jiggles it or shakes your legs to keep stuff going, at least while you're with them. I don't think you don't go home with them, but keeps the blood flowing. So that's something important to be concerned about. I mean, I don't know how concerned you need to be. I don't know how often it happens. I'm not a doctor, but they put it out there for you. So that's some of the the pre-op guidelines, things that they want you to do. And again, I think they're pretty basic, and I'm doing them all and feel all right. As for schedule with this thing, you know, again, I don't know how I'm going to feel going forward. I don't have any schedule or timeline or syllabus on how to, you know, I'm going to report back to you guys and tell you how I'm feeling, tell you how you should feel or things feel, how the surgery's going, sensation losses, diet, appetite, you know, all that crap. I don't know. So, I mean, I'm going to try to, I'm doing one today, obviously the day before surgery. I'm going to try one a day after surgery, likely, maybe second day after surgery. Day off, probably not going to happen. Week, 2 weeks, a month, 3 months, 6 months, 12 months, maybe some sort of, so you can follow my progress and journey, and I'll keep filling you in with the best I possibly can with information and impactful facts and feelings, really, of you know, what to expect and what I'm feeling. I can't say that everything I'm gonna you know, mention here, report back to you is gonna happen, or to you, or in any case. I'm not a medical person, but at least giving you my experience, and you can take it for what it's worth and make your own decisions and you know, get to a happier self. That's what we're doing. What else? Well, I guess I'll just show you the reason why I've elected to do this surgery. You know, body type and the reasons. It's going to be pretty apparent, I think. And I guess we'll go from there. So, as you can see here, let me pull this down here a little bit without showing you Old Glory. I don't know why it's so bright on my stomach, radiating electricity, but here it is. This is the rendering of lots of booze, lots of Big Macs, and 60 pounds of weight loss later. You know, total dysfunction, disformity in the human torso, as far as I'm concerned. You know, to keep perspective, I'm a 36-inch waist, maybe a little bit less now, and you know, these flanks are just out. And you know, when these flanks are sucked and so on, you know, I think it's going to tie right in nice to a 36-inch waist, and you know, I'll look pretty normal. But you know, as you can see here, and I got big mitts. You know, what I can grab here is significant, right? And you know, this ain't going away with running or cardio. I mean, this is just extra skin. You know, it's not going to tighten up on its own. And it's sad, right? It's just you know, you probably look at something similar to this to yourself, and this is why you're contemplating getting this surgery done. But whew, when you look at it, you know, it's just rough. And you know, can't walk down a beach, feel confident by yourself. You know, you think everybody's looking at you, looking at this guy, you know, feel bad for him, or you know, what a fat ass, or you know, whatever the case might be. But you just can't enjoy those simple things in life, which so many people that don't have this problem take for such granted. And so I don't know. So you know, so what they're gonna do is they're gonna liposuck these areas here. If you see the flanks, try not to moon you. If you look at these flanks here, all fat, extra skin. He's gonna suck all this out. He's gonna pull it out, suck it out real good, all the way around. So hopefully the ultimate rendering will look something like, you know, that. That would be fantastic. I'd be very happy with that. So all this gets sucked out. He's gonna do a lot of liposuction, you know, through here as well. And as far as the tummy tuck goes, it's gonna cut way down here, right in your pubic area, all the way across side to side. So I'm gonna be left with a big scar here. But you know, if it's way down here, obviously my pants are up, my underwear is up. You know, it's hidden. And I guess after a year, you know, the scar really starts to dissipate, and you know, closer to 2 years, you know, hopefully gets very close to the same color as your skin, so it's not as noticeable. But so he's gonna cut here all the way across down here, and he's gonna come up to my belly button, and he's gonna cut at
think just above it. And he's going to cut all the way across here. So in fact, in this area here, all the way down here is gone. So all this is gone. And he's going to take this area here and he's going to pull it down here and he's going to tie it into here. So this is gone, fat's gone. It's tight, you know. It's going to be wonderful, I'm hoping. So, you know, if this is gone and I don't have to sit around, look at this anymore, and do this in front of a camera, you know, or in front of the mirror, then I'm a happy man. As far as the gynecomastia goes, for the guys that are going to get that done, so I'm getting a lot of work done. Liposuction, flanks, liposuction, tuck, liposuction, tissue removal. So the doctor's comfortable with doing all this on one day, so, you know, I'm okay with doing it all on one day if he's good. But basically what they're going to do is they're going to liposuck. You know, they're going to liposuck this whole area. You know, one thing about, you know, the reason, you know, obviously being a man and having tits is demasculating as it is. You know, but no man should be able to go like this, you know, and to have, no man should do that. No, you know, it's just a miserable feeling. And, you know, that's a, you know, basically an A or a B cup, and, you know, it's like going for a handful of your wife's or your girlfriend's boobs, but feeling the same thing on yourself. You know, it's kind of fucked up. Nobody wants to have that feeling. So, long story short, you know, he's gonna come back here. He's gonna liposuck all the way back here. You know, all this is gonna just totally get liposucked out. All this is fat all the way around here, and then he's gonna come in with a scalpel and about a ½ an inch or so under my nurple. What's the medical word for it? Areola, something like that. Anyways, so he's gonna cut about a ½ inch right there, just a little incision, and then he's gonna pull out the breast tissue. The breast tissue is something I developed young. Chest is a lot less than it was when I was 300 pounds, but, you know, it's still significant. And I was a little bit concerned about skin retraction, you know, how it's going to look. Is it just going to sag down because there's no fat there? I mean, how's the skin going to tighten up? And he's using laser lipo, which apparently the heat, there's not a lot of extra skin, as there is, but the laser lipo, you know, that laser hits the skin, it kind of shrinks it, you know, a bit. And so he's not concerned that I'm going to have this significant amount of extra skin, and that, you know, the final result, you know, it should be something like this, you know, totally flat, etc. You know, from side to side compared to this, you know, even just flat, you know, masculine. So, I mean, that's pretty much what's happening. You know, I think it's going to be an excellent turn in my life, and I'm really looking forward to it. So, you know, that's pretty much what I'm having done. I'm going to go ahead and put my shirt back on now. Not usually one to talk in front of the camera and the buck, at least at this point anyways. Maybe I've had the surgery and I'm looking good, maybe I'll do that, but that won't be suitable for YouTube. Alright. So, you know, that's about it. You know, tomorrow's coming quick. It's about 12, 13, 14, about 14 hours away from surgery and getting going. And again, I'm looking forward to it. Maybe I can answer questions after I post this. I'm not exactly sure. I think there's a spot for me to answer questions, and I'll do my best to get to them when I can. However, I'm not sure how I'm going to be for the next few days, but at the end of the day, I hope you guys get something out of this. I mean, maybe you don't, maybe you do, I don't know, but you know, I hope maybe you pull one thing out of here that gives you some confidence, or makes you feel like you're not crazy, and that you're doing the right thing, and you're heading in the right direction, and you know, that's the reason for me doing this. So I wish you guys luck, you know, with your choice and your decisions, and I'll be back with another report as soon as I can. Thanks, guys.